Back on this Saturday morning Sports Medicine Weekly, I'm Steve Kashul along with Dr. Charles Bush-Joseph, filling in this week for Dr. Brian Cole from Midwest Orthopaedics at Rush. Dr. Chuck, great story right here about a cardiac arrest survivor who works as a physical therapist with ATI. And let's get him on the line right now. Jacob Holler is with us. And Jacob, I want you to tell your story because we've done some research on this, both Dr. Chuck and I, and it's fascinating. So tell us first what happened on April 22nd, 2017.
Yeah, so, April 22nd, 2017 started like a normal day for me, ended very abnormally, or so I'm told. I don't actually remember it, but what happened was going about my normal day. At about 7:30 in the evening, my wife heard a funny sound from the next room and came in to find me unresponsive, so she immediately began CPR, called an ambulance, did all that stuff. She used to be an EMT, so she knew exactly what to do. Got the ambulance out to me in about 8 minutes. They were able in another couple minutes to revive me, get a heartbeat back, and then we went to the hospital. So that was when they found that I had had a sudden cardiac arrest at home. So that was April 22nd, 2017. And I was in a coma up until about the middle of the 23rd, and then, awoke from that, was extubated, and had a few days in the hospital to recover.
Jacob, like many, did you have no history, no cardiac history at all? Were you, obviously you're a physical therapist, you're a vigorous man with an active job in life. Was there any clue that this could happen to you?
So I had some congenital malformations at birth, but I had actually been released from the care of a cardiologist when I was about 20 years old, and hadn't been followed up since. Was told I didn't need to be. So there was no indication. I actually felt great that day, as far as I'm told. I worked out in the morning, went for a run with my dogs like I normally do on Saturdays. So yeah, it was a normal day.
Well, let me ask you this. You're a smart man. You've got a doctorate in physical therapy. You deal with patients on a daily and regular basis. You're aware of the science now. What have you learned over the last year? And obviously, it seems like now, from what Steve and I are reading, has become a life avocation for you.
Yeah, so, it's been a really interesting experience. And I knew the science fairly well from having a, cardiac history as a kid. One of the things I learned was that there's a difference between a cardiac arrest and a heart attack. But cardiac arrest is just when the heart stops. It's not necessarily a blockage to an artery or anything. But the thing I really learned was that it's important not to let something like this get in the way of you doing the things that you want to do. Something like this is scary, and that fear can rob you of a lot of the things that you want to get done in your life. For a while I was considering whether I should go back to work or what kind of goals I should pursue, and if that changed after this event. And what I found really is that in challenging myself, it's kind of like peeling back an onion. You peel back layer by layer of fear, and you work into those things you really want. And you find that most of the things you wanted, you want to go at more vigorously than ever before.
Visiting with Jacob Holler, a cardiac arrest survivor, now is advocating for the cause, and he's a physical therapist and clinical director at ATI Physical Therapy. And how does that extend to your patients, Jacob?
It certainly helped me to be a little more empathetic toward people. When you're a physical therapist, you start out, you're pretty young, and you think you can get into the shoes of somebody else. But if you haven't really had the experience of being a patient, and all of a sudden finding yourself in a situation where you are not at all where you expected to be, like many of my patients are, it's difficult to really assume that and get into that role. So it's helped me certainly with connecting to patients.
I think all providers need to undergo treatment or have a problem. I think, as you said, empathy is the key. It helps. I'm sure it's helped you connect closer to your patients to sort of see the anxieties that patients have. I'm still interested in the last issue that, how do you advocate this now? What do you see your role in public education, having gone through this type of experience?
Yeah. So, the first thing I did was on the anniversary of the cardiac arrest, I kicked off a week-long fitness challenge. So I ran a marathon on the actual anniversary, April 22, 2018. That was my first marathon. I lifted 100 tons 3 days after that. And then on 4 days after the 100-ton challenge, I did 5,050 push-ups in a day, and I did all of that to help raise money for the Sudden Cardiac Arrest Foundation. I've been, going out, doing some speaking events, trying to get some money together to train kids who are graduating from high school in my area to get CPR certified. So CPR certification saves lives. It's inexpensive. It's easy. Anybody can do it. So I encourage anybody listening to get CPR certified. You can save a life.
Great stuff. Jacob, thanks so much for sharing your story. Congratulations to your wife, your hero. ATI does a wonderful job. ATIPT.com is their website. It's happy to hear you here as a celebrate a year of survival. And congratulations on your great advocacy as well.
Thank you.
Appreciate it. Jacob Holler from ATI. We're going to take a break. When we come back, it's our staple of our show called Ask the Doctor. We got some great questions this week for Dr. Charles Bush Joseph. I'm Steve Kashul. Stay with us. You're listening to Sports Medicine Weekly, only on 670 The Score.